Think back to your childhood, when you'd visit the doctor's office, often with just a little bit of fear in your heart, arriving with a parent and waiting in the waiting room. My pediatrician's office had toys and magazines, and the TV was always on. I remember that specifically. We faced our fears and we got through the appointment, and for me, we were given lollipops. It was truly my favorite part of the whole day. I imagine, like me, many of your experiences and expectations of an appointment were shaped by those early memories. But in the years that have passed since then, until maybe around, I'm not sure, let's say 2020, did you ever imagine attending appointments through a phone, a laptop, or a tablet from the comfort of your own home? Maybe the Jetsons inspired you to dream big, but if I'm being honest, the idea of a virtual visit, now known as telehealth, never crossed my mind until it became a reality. That's what we're talking about today, telehealth, and the way it's shaping healthcare. Let's listen in. You're listening to MedBoard Pulse, a podcast by the State Medical Board of Ohio. I'm your host, Jerica Kent, Chief of Communications. Let's talk Ohio. Thanks for tuning in today. Telehealth is what we're talking about, and it's a huge topic. I won't even pretend like we're going to be able to tackle every single aspect of it. But as we've been exploring lately, telehealth is one of the emerging practice trends the board is closely monitoring because there are real implications for patients receiving care, and it's our responsibility to ensure patients have access to safe, reliable care in Ohio. I will let today's guest provide you with the history of telehealth regulation in Ohio, but let's first make sure we have a definition to work from. Telehealth is defined as healthcare services provided through the use of information and communication technology by a healthcare professional within the professional scope of practice, who is located at a site other than the site where either of the following is located: the patient receiving the services, or another healthcare professional with whom the provider of the service is consulting regarding the patient. I imagine many of you have experienced a telehealth appointment, whether during the pandemic or in the last several years. There are many encounters that happen every day. Telehealth can be used by physicians, physician assistants, advanced practice registered nurses, optometrists, pharmacists, dietitians, respiratory therapists, genetic counselors, psychologists, chiropractors, occupational therapists and physical therapists, audiologists and speech pathologists, as well as various counselors, therapists, and certified behavior analysts. Of course, the board only regulates a portion of these providers, but it's interesting how in a short period of time, the way that providers can see patients has changed significantly. One of the main arguments for the expansion of telehealth has been ensuring patients in particular vulnerable and hard-to-reach areas continue to have access to the care they need for chronic conditions or their everyday lives. Of course, whenever something new comes on the scene that impacts our providers, the medical board needs to be informed and to ensure that it can be implemented safely. Today I've invited back our Chief of Enforcement, Brandon Puckett, to tell us about the telehealth laws and rules in Ohio. Welcome back to the show, Brandon. Can you please just remind our listeners what your role entails?
Yeah, my name is Brandon Puckett. I am the Chief of Enforcement with the State Medical Board of Ohio. That means that I oversee a team of attorneys and support staff that prepare cases and evaluate them for potential violations of the Medical Practices Act that may result in a hearing.
Sounds fancy.
Yeah.
So today we're specifically talking about telehealth, and by now I'm guessing most of us have experienced a telehealth encounter of some sort. But for the sake of clarity, can you please give us the statutory definition of telehealth so that we're all on the same page?
Yeah, so it's defined by a rule under the medical board's rules. If you want to look it up, it's 4731-37-01. There's a lengthy definition there. But basically, telehealth services is defined as a healthcare service that is provided through technology by a healthcare professional who is licensed in Ohio. And within the scope of that person's professional practice, they are somewhere located different from where the patient is, if I can paraphrase.
I appreciate the parameters put around that because what we're not talking about today is someone that's licensed in, let's say, Texas or Tennessee or Minnesota. We're talking about Ohio licensees, but they could be physically located in another location. It seems like COVID played a big part in accelerating regulations on this topic. Can you tell me, when did Ohio adopt laws and rules to govern telehealth?
Yeah, that's right. I mean, in the history of all things legal, I mean, things develop slowly over time, but this is more like something that kind of avalanched down into our practice. So there's a brief history of it, that goes to the COVID-19 pandemic. Sort of right away in March 2020, there were temporary emergency rules that were put in place, but then it became clear that everybody sort of needed these to become more permanent than they were. So a law was passed in December of 2021 It became effective in March of 2022. And then there's a rulemaking process. So sort of leading through that, the medical board updated its rules in February of 23. So again, if you think about it, this is a new rule. It's been in practice and on the books for just a few years.
So really, we kind of lived through history in that way, because I do remember when that happened. In fact, I remember before we had official rules, we put everything on hold. So for appointments that normally required in-person visits, because there was a pandemic, we decided not to enforce our rules that would have required that face-to-face encounter.
Right, right. I mean, the practice was there was a huge issue with access to medicine, and we needed to make sure patients were still getting what they needed, and that practitioners could still reach out to their patients. And temporary rules provided sort of guideposts, I think, and then the whole rulemaking process and legislative process culminated in 2023 when we've got the telehealth rule on the books now that we're talking about.
What providers in Ohio can practice telehealth? I know that it goes beyond the board's licensees.
So that's covered in the rule. So along with defining what telehealth services means, there's also a definition of who a healthcare professional is that can do telemedicine. That includes obviously physicians, which are MDs, DOs, DPMs. It also includes licensed physician assistants and licensed dietitians, respiratory care professionals, and genetic counselors. Those are the ones that are within the authority of the medical board. We issue their licenses, but there's other types of healthcare providers like nurses that I can't touch on. They have their own separate nursing board. But yeah, those are all part of, those are the licensees that are listed in this rule.
I think it's important to recognize, like you said, there are licensees beyond our jurisdiction who do have this ability, because really it changed how healthcare is taking place. So there are a variety of folks so that people can have access to the care they need for chronic conditions, or if they're maybe in a rural location, or whatever the case may be. Are there trends we're seeing in how telehealth is being most commonly used?
I think you'll see it used a lot in behavioral health and counseling
Interesting.
areas. Telehealth is also done with established patients if they're already in your practice and you're doing a follow-up consultation. If you're reviewing lab results or managing medication, probably not a need to make a patient come in for that. Managing chronic health diseases is something else that we see a lot. Some forms of primary urgent care, inspecting a rash, maybe, cold and flu symptoms, maybe those can be taken care of through telehealth. And you can probably meet the standard of care for all those things. And I think the important thing to remember is the standard of care still has to be met. Our rules mention that phrase not just one time, but 9 times just in the telehealth rule. So
Just
it's
in case they didn't.
right,
That.
right. It's in there over and over again that, there isn't really a limitation on what you can do with telehealth, except the standard of care, which is, if you think about it, a significant limitation. If you need to physically see a patient, then that's what's required. You still have to have in-person, patient encounters for that.
I'm glad you touched on that, because that was something I remember our legal department really emphasizing, kind of as the first answer when people say, well, what can I use telehealth for as a provider?
Yeah.
And if you cannot reach that same level of care, then you need to see that person in person. It's important to have an in-person encounter for that.
That's right.
So what is the intent of the board's telehealth rules?
Yeah. It was to permanently expand access to healthcare. We saw the need for it acutely with technology that we probably had already, but then COVID pushed so many different areas of work into, tele or sort of remote work being possible. And so patients got greater access to treatment and providers, and it reduced the need for in-person visits. But the intent is also not to change that standard of care. It still has to be met. Like I said, it's mentioned so often within the rule. It has to be still at the same level as an in-person visit. So if an in-person visit would require examining the patient, physically laying hands on them, you shouldn't be doing a telehealth visit. If it requires, urine screens or follow up on controlled substance issues, examining how somebody is ambulating, you might not be able to do that through a Zoom call. So the intent of the rules is to never change that, but to increase access to healthcare.
So if I'm a patient and I have a broken leg, perhaps I shouldn't push for telehealth visits.
Yeah.
Perhaps it may be helpful
That too.
to expect to be able to see someone in person.
Yeah.
If they need to be monitoring or checking the status of
Yeah.
my broken leg.
And I like the way you phrase that, pushing for it, because I think patients are asking for it a lot nowadays too. And you need to be sort of the gatekeeper on whether this is the right way to see that patient, maybe in person. Another part of the rule is that, there's particular concerns around controlled substances, and the rule speaks to you still need to be following the federal law governing controlled substances, and also follow the controlled substances rules, which generally say that you need to be meeting in person with a patient to first establish a patient relationship. There's limited exceptions to that under the controlled substances rules, such as if you have a patient receiving hospice or palliative care, or other sort of things. But you should generally be seeing a patient. If prescribing Schedule II controlled substances, you should begin seeing them in person.
We have so much more to learn about telehealth in Ohio. But first, let's hear from Dr. O'Neill on our topic in the Medical Minute segment.
Hi, Jerica. The topic for today's Medical Minute is tick bites and the risk for Lyme's disease in Ohio.
So let's talk about that. I've heard about it. I've seen it on the news, especially the last couple of summers. Why should people be aware of ticks when they have outdoor activities?
Sure. Lyme disease is caused by an infection. In Ohio, it's transmitted to humans from a bite of a black-legged tick. The cases are increasing because the range of black-legged ticks population continues to expand, and encounters with them are increasing, particularly in their forest habitats. And forest habitats are preferred by this tick. And the black-legged tick has been reported in all 88 counties. However, it's the highest in the southern regions of the state. A recent study by the Ohio State University reported that the risk for Lyme disease in Ohio is now equal to Connecticut. And the study found that there's a prevalence of infection in captured ticks had increased to 47.6%. So significant change in the last 10 years.
Interesting. Okay, so it sounds like Ohio does have a lot of foresty kind of areas. What are some of the symptoms of Lyme disease so someone would even recognize that if that's what was occurring?
They can include what we call a bullseye rash, which in medical terminology is called erythema migrans. The rash is often characteristic of Lyme disease and usually appears within 7 to 14 days after the tick bite. The rash may be warm, but typically it's not itchy or painful. You can also have headache, fever, chills, muscle pain, joint pain, and fatigue, but that's not, classic or characteristic of Lyme disease.
Right. It sounds like a flu or something like that. What should you do if you think you or someone you know has these symptoms and you have some concerns about that?
Sure. You need to see a healthcare provider, and they may take a blood specimen for laboratory testing. You can go to the CDC website. They have a great website for more information on diagnosis and testing. And most cases of Lyme disease can be treated with 10 to 14 days of antibiotics. And people treated with appropriate antibiotics in the early stages of Lyme disease usually recover rapidly and completely.
Okay, that's good news then. So what are some safe habits that we can have as we're venturing outside for the summer months?
Sure. The best way to prevent Lyme disease is to prevent tick bites. And if you're outdoors, you need to avoid tick habitats. So ticks, as I said, thrive in wooded, brushy, and grassy areas. So when you're out hiking, you need to stick to clear trails and walk in the middle to avoid brushing with vegetation. You need to dress defensively. Wear closed shoes, long sleeve shirts, long pants, tuck them into your socks. Wear light colored clothing so you can see the ticks that are easier to spot. And you need to use insect repellent effectively. You can go to the EPA repellent finder website to find the best product for your needs. And then when you come back indoors, you need to really perform a full body check. Ticks are tiny. You need to check common hiding spots, such as your scalp, behind your knees, under the arms, in and around the ears, and in the groin area.
Oh, no.
Yes. And showering. Shower within 2 hours after coming indoors. You can wash away those unattached ticks. And you need to make sure that ticks are killed on clothes. So you need to place your outdoor clothing in a dryer on high heat for at least 10 minutes to kill any of those lingering ticks.
Interesting. Well, okay, it sounds like there are things we can do then to help keep ourselves safe.
Definitely.
I think my favorite part about this is that it doesn't affect my beach vacation.
No, it will not affect your beach vacation.
Thank you so much, Dr. O'Neill.
You're welcome.
Transparency is critical to patient safety. The medical board provides data that shows the number of submitted and closed complaints, citations and settlement agreements, and allegations of licensing misconduct. To learn more, visit med.ohio.gov and click the tab for the public.
Welcome back to the show. Today we're talking with our Chief of Enforcement, Brandon Puckett, all about telehealth and how it's used in Ohio. Let's listen in. What do the rules that we have in place, because again, we've established they're there really to expand access. That was something that was very important to our legislature in particular, and making sure that Ohioans everywhere across Ohio, because not every, right, we live in Columbus, Ohio. Mm-hmm. I love living in Columbus. But Columbus is not the average, city size, right? And in Ohio, there are a lot of places that are smaller, that have fewer specialists, or just maybe they have to drive a longer distance to get to a provider's office. Right. But we know also that telehealth does not fix all things. It's not a one-size-fits-all. There definitely are scenarios in which it may not help. But also, what do the rules not address when we're talking about telehealth?
Yeah, so there's a lot of telecommunication that you probably have with a patient through your office that is not going to be covered here, like a routine phone call, a communication that's just passing on information to the patient, an appointment reminder, communications from your front desk, things like that are not going to be, a health care encounter. Billing, Medicaid and Medicare, things like that. The telehealth rules don't touch on that. Also treating patients located outside of Ohio. If you are a practitioner in Ohio licensed here, our Ohio rule is not going to apply to you making a call to Pennsylvania or somewhere. So if you're encountering a patient in another state, you should be licensed in that state too.
What about, I know I've gotten this question before in our general inbox, a provider who is licensed in Ohio who has a patient who normally is physically located in Ohio, but let's say they're a student and they're in college, right, and they're in Indiana for this time period. What about that kind of scenario?
That does get a little nuanced. That's a good question. If it's an established patient that you've seen in Ohio, you can verify through telemedicine their identity and their location. If you have a pre-existing relationship, I would say you can treat that, try to treat it similarly to how you would maybe. I know people have patients that go and vacation in Florida and they call in to refill a prescription. There are times when you can do that. I would view it as that. But if you know that you're establishing a new patient in another state and it's telemedicine, and you don't have a license to practice, this person clearly resides in another state, that's more bright line. Like you should have a license to practice in that state, just as we would expect somebody establishing a patient in Ohio, a new patient in Ohio, calling them up, doing telemedicine. They should be licensed here.
Absolutely. I know that exception is in statute, and it's very narrow, like you said. It's,
it is, yeah.
It's like, I think within a year's time or something, you can treat that patient if you've seen them in person. Do providers have to pay attention to federal telehealth regulations?
They do, and this can get complicated depending on what your practice is. If you're a DEA registered practitioner, trying to prescribe controlled substances to patients across state lines, you need to follow their rules. And I'm not an expert on their rules. As somebody employed by the State Medical Board of Ohio, I can help with that aspect of things. But, if you're dealing with Medicare, Medicaid, you need to know what rules they have in place. So the more involved you are with these things, you need to realize that in this federal system that we have a telehealth rule, but you might be engaging in other areas of practice that have other rules.
What kinds of issues is the board starting to see with providers that use telehealth? Because again, as with any new innovation, and again, we're not brand new anymore. It's been several years since telehealth has taken off and has become more pervasive. But of course, you're always going to start seeing stuff slide a little bit and people being taken advantage of, or maybe sometimes it's a monetary gain that motivates someone to cut corners.
Right.
What kind of issues are we starting to see?
Yeah, so I would start by saying that a lot of practitioners are just using this as a new tool and the standard of care is being met. and patients are getting increased access, which is, great. But one thing that some providers are letting slip is that patients are doing more and more of their appointments through telehealth. Somebody with a chronic issue, you might be able to follow up with them, but there's also a point where I think the standard of care is you need to physically examine them again. You need to see how they're doing and observe them. So if you go too long and it's all telehealth all the time with a patient, you should question whether the standard of care is still being met there. Charting can be an issue too. Just because somebody is remote doesn't mean that your charting should be any different from an in-person encounter. On the really extreme end of things, we have some providers who are out of state. We've talked about this a little bit. Folks who are not in Ohio and they're doing telemedicine prescription writing. We had a doctor a couple of years ago that lost his medical license because he was prescribing ketamine all over the country, including to some patients in Ohio. He wasn't seeing them. He wasn't monitoring how they were responding on the ketamine. He wasn't meeting the standard of care. He was writing the scripts. On that extreme end of things, telemedicine becomes dangerous.
You were talking about a case specifically where a physician was prescribing ketamine, and ketamine is a controlled substance. It is very powerful and very useful, but also can have some dangerous effects if it's not properly monitored.
Yeah.
Are there other cases the board has seen in recent history? I know we keep talking about the emerging practice trends on this podcast,
Right.
because the board is this committee, and we're starting to see trends that, again, they're things that are helpful for people and for patients, but also when they're not applied correctly, they are presenting dangerous results for some patients. And so telehealth keeps coming up over and over again. Our board members are concerned about it. It's a great tool, but if a tool is used incorrectly, we know how that ends. Are there any cases you can think of in recent history where the board has had to discipline a provider due to telehealth?
Yeah, I think we have a steady stream, unfortunately, of knowledge of cases and cases that we've cited on that involve just not pursuing red flags as you might usually pursue them with telehealth. If you have somebody who's on chronic or going through chronic pain, and you're trying to alleviate that, you're prescribing opioids, that's an area where red flags can be missed. If you're not doing pill counts, if you're not making people come in for urine screens, if you're not sort of laying eyes on the patient, you might be missing those things. And then the standard of care just isn't met. And we unfortunately, we have to cite or try to correct behavior in those types of practitioners. So in addition to that, we also become aware of a lot of criminal conviction cases where people have engaged in telehealth for, that involves kickback schemes and, just inappropriate prescribing or overprescribing or prescribing that's kind of related to nationwide business practices. At the end of the day, the individual doctor who's doing the prescription and doing the telehealth visits across the country is going to be held liable if something is being prescribed when it doesn't need to be prescribed, when there's a kickback involved. So unfortunately, it gets tied up into these more serious, sometimes criminal matters.
I feel like I've heard a couple physicians come before the board and basically plead ignorance. I didn't realize this company was doing like this.
Right.
Like, I was signing off on these things. I never saw the patients, but I just thought that everything was on the up and up. And that's not a good enough answer for us.
Right. And you should sort of not let your judgment slip past you. You're seeing too many patients a day, and you're working for somebody that's expected you to always sort of rubber stamp a prescription, and to make the telehealth happen sort of quick and easy and routine. Each patient probably has their own nuances that need to be looked at, and if you're doing the same thing and you're just using telehealth as a vehicle to accomplish those means, you have to be very careful with what you're doing with your license.
Slippery slope there.
It is.
I've also noticed an influx of commercials advertising telehealth services. Do you think we'll continue to see big players into the telehealth scene?
Yeah, I think so. And on the extreme end, as I answered in a previous question, you need to be careful what a company is asking you to do. That sometimes they're asking you to do something that is just medically inappropriate, and I think it's going to become more and more of a temptation. There are providers that need to keep in mind that you're trying to serve a patient at the end of the day through your telemedicine. If you're in one of these industries where these are being distributed a lot, you have to ask, is the medication really being indicated for that patient? Am I meeting the standard of care? If I were just individually assessing this patient, in person, is that the conclusion I would lead to? Is there a documented reason for providing that prescription? Because if not, I don't think you're meeting the standard of care, and you might be violating the Medical Practices Act.
And from the patient end, because the podcast really is specifically for public information. From the patient's end, we're telling the providers, be thinking through what you're doing and how you're using this tool. What should a patient expect from these encounters?
I think they should expect to still be receiving the same quality of care. And, if something is missed, then, think about it from their perspective. They saw a doctor, they had the assurance that telemedicine was okay for them, and the doctor didn't ask them to come in, and yet something was still missed. So from their perspective, it's still a lot of reliance and a lot of faith in how you're doing your job. So just be mindful of that.
What would you say is the big takeaway from the board's telehealth rules, again, and how we're looking at the regulation of this in healthcare?
Yeah, it's part of the future of medicine. The rules exist to keep helping patients and keeping providers connected with them and having better access to each other. But I also think that there may be more and more pressure to have more medicine become more remote based. Patients are going to expect it. They may pressure the doctor to do a telehealth visit when that's not the right type of visit at that time. And the healthcare provider needs to ask if the standard of care can still be met for something that isn't an in-person appointment anymore. The takeaway is that even though telehealth is changing the practice interface, it's still not changing the standard of care.
Well, Brendan, I appreciate you coming out today, meeting me for this. There's a lot to learn about. We're still learning, I think, when it comes to telehealth. We're still seeing what's unfolding, but I think the medical board is in a pretty good position to recognize some of the risks and dangers, but also to make sure that providers are educated and understand how to safely treat their patients. Again, thank you, Brandon, today.
Thanks for having me.
Absolutely. As we see the use of telehealth increase, we know that people are using it to do fantastic things. But also, we want to make sure that our providers remain consistent and are meeting the standard of care in all of their encounters. As a patient, you are entitled to quality care. If a provider is not able to meet the standard of care, telehealth is not a good option for you. Remember, ease is not a replacement for efficacy. If you do have concerns about care you've received, please file a complaint today by visiting med.ohio.gov. We want to make sure that you are informed and know what to expect in encounters. Like Brandon said, telehealth is here to stay, and I'm sure we'll continue to see it morph and change in all of the ways that technology can improve its use and make it more accessible. We very much appreciate you tuning into today's episode, and I hope that you join us next time. Thank you for listening to this episode of MedBoard Pulse from the State Medical Board. A special thanks to our Chief of Enforcement, Brandon Puckett, for shining some light on how telehealth can be used in Ohio. For more information about the Medical Board, visit med.ohio.gov. You can also email questions or comments to communications@med.ohio.gov. And remember, the more you listen, the more you'll learn, the more you'll share.